There is a lot of ignorance amongst patients regarding surgical diseases. Pain while passing stools. This is a symptom. Now a person has this problem, he doesn't know what is it due to, but he's scared. The first thing in his mind, is it a cancer?
You are watching Surgery Simplified, शास्त्रकला सरल शब्दों में।
हेलो नमस्ते, वेलकम टू आवर चैनल सर्जरी सिंप्लीफाइड, शास्त्रकला सरल शब्दों में। मैं हूँ ऐश्वर्या एंड वी हैव आवर वेरी ओन लविंग डॉक्टर निखिल।
Thank you, Aishwarya. And hello to everybody.
So डॉक्टर, लास्ट एपिसोड में हमने देखा वी वर आउटडोर्स मोस्ट ऑफ द टाइम एंड वी गॉट अ चांस टू स्पेंड विथ यू टू सी कि आपका दिन कैसे बीतता है। सो वी सॉ यू नो मूव बिटवीन हॉस्पिटल टू हॉस्पिटल एंड यू लुक अप टू द पेशेंट्स हु कम इन। काफ़ी भारी मात्रा में पेशेंट्स आते हैं इनफैक्ट। सो थैंक यू फॉर गिविंग अस द चांस टू बी देयर विथ यू द होल डे। सो इट वॉज़ वेरी इन्फॉर्मेटिव। आई एम श्योर हमारे व्यूअर्स के लिए भी बहुत इन्फॉर्मेटिव होगा। तो मुझे एक्चुअली काफ़ी टाइम से पूछना था आपसे, बट आई गॉट दिस चांस, चलो आज पूछ लेती हूँ। सो वी केम अप विद दिस चैनल सर्जरी सिंप्लीफाइड। सो व्हाट हैज़ बीन योर मेन मोटिव कि मुझे ये स्टार्ट करना चाहिए?
Well, it's a good question because the whole purpose of this activity needs to be informed to the viewers. You see, surgical diseases, unlike medical diseases, are very less understood. Because very few people speak about them.
Right.
Secondly, surgical diseases compared to medical diseases only for maybe 10 to 15% of an OPD. OPD is an outpatient department, what you saw yesterday.
Correct.
Now the crowd that you saw there, only a fraction of that crowd was surgical patients.
Okay.
Majority of them were medical patients. So as such, patients need less visits to a surgeon as compared to a physician. Second thing is there is a lot of ignorance amongst patients regarding surgical diseases.
Ignorance?
Ignorance means they don't know what is it that is gone wrong with them. Now everybody knows you have a cough and a fever, you go to a doctor.
Right.
But so, for example, you have a swelling here. You don't know what to do with this.
Correct.
Okay, you're scared. Is it cancer? Is it not cancer?
Or some skin disease?
Yes, or is it a skin disease or what is it? And you avoid going to the doctor because you don't want to hear bad news.
Right, that's true.
And then when it starts becoming bigger and bigger, that's when you say, okay, I must go and show it to a doctor. Even there, first time the person will go to a non-surgical doctor.
Right.
And that person will refer it to us. So we get more referral practice than direct patients coming. Very unusual for people to come directly to surgeons. So what I thought is if I can break this barrier which is there and present clinical surgery to our viewers and tell them that there is nothing to be scared of. Just like you go for a fever or a cough to a doctor, you can go for surgical problems. So clinical surgery is basically symptom wise classification of disease.
So is that what you are going to tell us about?
Yes, so what I have decided now is that we are going to discuss clinical symptoms and then what are all the causes for that symptom and then go into details of each care.
You said symptoms.
Yes.
तो मतलब बहुत सारे clinical symptoms हैं.
Yes, I would say for example bleeding in the stools. अभी किसी को संडास करते वक्त खून जाता है या पेनफुल defecation or what is called as pain while passing stools. This is a symptom. Now a person has this problem, he doesn't know what is it due to, but he's scared. The first thing in his mind, is it a cancer? Is it something where I'll need operation? They are so scared of operation that they avoid going to a surgeon, hoping that the physician colleague will give him something which is going to avoid surgery.
Okay.
Obviously, not all conditions need surgery, and not all conditions in a various stage need surgery. At a particular stage, surgery becomes compulsory. But there are ways in which we can treat without surgery, but it should be done by a surgeon. See, there is a difference between non-surgical treatment and medical treatment. You know what I am saying? For example, a physician treating fever is going to be only with medicines. If a person comes with fever to a surgeon, he is going to find out what is the surgical reason for the fever. For example, is there pus somewhere in the body? And that may lead to operation. But it may also lead to just giving medicines and curing the abscess. Now, why I want to make this distinction is that if you allow the pus to remain inside, at what stage you should abort or stop medicines and go in and remove the pus is a surgical decision. And that is why right from the beginning, such a patient who has got suspected pus somewhere in his body would have to be under the care of a surgeon. Then he may use surgery as a treatment choice or not. Okay. But it still becomes a surgical problem. Now here where is the confusion? People think that because a particular condition may be treated with medicines, it is a non-surgical condition. I'll give you an example. Thyroid. Thyroid is basically a surgical problem, but it is also being treated by endocrinologists and other medical colleagues, because most of the times thyroids may not need surgery. But what happens if a thyroid swelling does need surgery? The endocrinologist cannot operate. So it is a surgeon who can treat both the medical part of the thyroid and the surgical part. This is what I meant. Now thyroid has been confused as an endocrine problem. It is not only an endocrine problem. There is a growth, there is a goiter, there is a tumor in the neck, and ultimately it is going to be removed by surgery.
Right.
Very rarely will the goiter or the swelling of the thyroid disappear no matter what you do. Yes, it can disappear or reduce in size, but it may not disappear completely. Now to completely disappear, you need a surgeon.
So सिम्टम्स बहुत सारे हैं, सर्जरीज भी काफ़ी टाइप के होते हैं, तो आज के एपिसोड में इज देयर एनीथिंग पर्टिकुलर दैट यू आर गोना टॉक?
Yeah, we'll start with what I thought is we'll start with common surgical conditions which more number of people we see in the OPD.
And are you also going to tell about the misconceptions?
Yes.
That patients have?
Yes. So what happens is whenever a patient has a particular symptom, he has lot of ideas in his head as to what. For example, a person is passing blood in the stools. First thing he thinks he has got cancer, which is the rarest thing. And there is a saying, if you diagnose something rare, you are rarely correct. You see? So he takes the worst case scenario, which is not the case. If you can see blood in the stools, chances are it is not because of cancer. So we have what is called as macroscopic, or where the patient himself can see blood in the stools, and microscopic, which is occult blood. Now that is the blood which actually is going in the stools, but you can't see with a naked eye. You have to do a stool test and then you see blood in that. That is the more dangerous blood. That is the kind of blood which comes in cancer.
तो मैक्रो में जब दिखता है then we know okay something is very unusual.
Yes.
But माइक्रो में जब तक कोई और symptom ना हो,
correct,
how does one get to know कि?
No, you don't. So what happens is that usually such a patient will come with general weakness.
अच्छा, okay.
Tiredness. Then you do his hemoglobin and you find that the hemoglobin which should be 14, 15 is 7 or 8 or 10 grams. Okay. And he has lost weight. He has now recently lost appetite. Now you investigate by doing a stool test, you find occult blood. Now such a patient, very high chance of it being a cancer. Because what happens, the cancer can be any part of the intestine. So by the time the blood bleeding from the tumor happens and it comes out from the rectum, most of the time it gets the blood gets converted into something else, and as a result it is not seen as red blood. But when you do a microscopic examination, you can see the RBCs, the red blood corpuscles in the stool. But because of the cancer growing in his body, he starts having the other symptoms, the generalized symptoms of cancer,
Right.
which is known as cancer cachexia. Cachexia means the general combination of loss of weight, loss of appetite, loss of muscle mass, tiredness, weakness, because you're harboring a tumor which is sucking out all the food that you're eating, plus it is hampering you from eating enough, and that is causing the weakness, the loss of the hemoglobin falling and all that.
So this happens, in a gradual amount of time, or is
Yes.
it like a sudden thing happens
No.
and you feel okay, something
No,
is not right?
no, it happens gradually. I would say over a few weeks or few months, not a few years.
Okay.
Cancers always happen in a few weeks or a few months, not in a few years.
And if it's not cancer, but it's piles?
Yeah. So let me say that the commonest condition, more than 80-90% of the times, is piles. What we call bawasir होता है, या उसको बोलते हैं कि hemorrhoids is the actual term, surgical term. So piles is the most important cause. The second most important cause is inflammatory bowel disease, IBD. अब what is inflammatory bowel disease? ये जो है आंतड़ी में सूजन आती है, large intestine, especially left side के large intestine में सूजन आती है.
And that causes pain?
Sometimes, but more of bleeding.
Okay.
इसको बोलते हैं अल्सरेटिव कोलाइटिस. ये बहुत कॉमन है इन वेस्टर्न कंट्रीज, एंड इट इज बिकॉज ऑफ मीट बेस्ड डाइट, नॉन वेज डाइट. सिंस मोस्ट इंडियंस आर वेजिटेरियंस and eat a good fiber diet.
Right.
And when we say non-vegetarians, we are not non-vegetarians. We occasionally eat non-vegetarian.
Correct.
Non-vegetarian means breakfast, lunch, dinner is non-veg.
Non-veg.
Here we Sunday to Sunday you have a little bit of non-veg, is not non-veg. Monday to Saturday you are having vegetarian. So because of a high fiber diet and no constipation or less constipation, cancer of the colon and ulcerative colitis, these are two conditions which are less common in India compared to the West. So the three conditions where you have bleeding per rectum, the commonest is piles, the second is inflammatory bowel disease or ulcerative colitis, and the third is cancer of the colon. So these are the three conditions that we will discuss in brief today.
Okay. So, doctor, you spoke about blood coming out of stool. So this is one of the symptoms of piles. So can you please put some more light as to what is piles and वो क्यों होता है? What are the causes?
Yes, basically piles is distended blood vessels, okay, around the anus. Now if you take anus as a clock, when the person is in the position for delivery, which is called lithotomy, then you have primary piles at 11 o'clock, 3 o'clock and 7 o'clock. Why these? Because blood supply of the rectum comes and divides into two arteries on the right side and one on the left side, and each of these arteries has a communication with the veins around the rectum. So these are artery and venous combination, and that is why bleeding from piles is bright red.
Bright red. Okay.
Yes, it's arterial bleeding, and bleeding from piles can cause very severe anemia. Okay, so what is piles basically? There are cushions in the upper part of the anus where there is a combination of some wall of the inner wall of the anus along with this blood, like a cushion. Now because of constipation, कब्जियत की वजह से और संडास करने के टाइम जोर करने से, straining, either because of constipation or in some people there are other causes, like somebody has cough, keep on coughing, smoker coughs and it causes pressure. Some older people who have a prostate enlargement are straining to pass urine without their knowledge. They keep passing urine but straining. Now as a result of this straining, these cushions descend and come out towards the outer part of the anus, and that is piles.
Okay.
Yeah. Now piles have grades. Okay.
Grades as in A, B, C, D?
No, grades as in grade 1, 2, 3.
Acha.
Okay. So grade 1 is if a person is only having blood, but the pile has yet not come out of the anus. Grade 2, I divided into 2 and 2 plus.
अच्छा.
2 is when there is bleeding and the pile mass is coming out, and if you ask the patient, he'll say, when I'm cleaning myself, I can feel it, that there is something there. But it goes back on its own afterwards. When he gets up, it goes back. Grade 2 plus is, it is coming out, but he has to push it back. It doesn't go on its own. And grade 3 is, even if it tries to push it back, it doesn't go out. It means it is always out. So it's very large piles. Okay. Now, why do we need to grade these piles? Because the treatment of piles is totally dependent on the grade.
Right.
So for grade 1 and early grade 2, the options are non-surgical. In the sense, a procedure has to be done by a surgeon, but it doesn't involve a proper operation.
Okay.
So what is done is, either an injection is given of phenol, which will cause the blood vessels to form a clot, or you get a small band, which is, you pull the pile and put the band, and the band will crush the blood vessel and prevent the bleeding. Because at that stage, the main symptom is bleeding. This can be done as an outpatient, on an outpatient basis. It doesn't have to be admitted.
Okay.
Totally painless. Over here you can also use laser, because laser also has the same effect of coagulating or stopping the blood. I mean, it takes care of the blood. When you come to larger size, that means grade 2 plus or grade 3, then these methods are of no use.
Okay.
You have to undergo surgery. Now, pile surgery is done by 2 methods. Again, rather, let us say 3 methods. The classical technique, which is called closed hemorrhoidectomy, where you pull the pile under anesthesia after admission. You have to admit the patient, you have to take to operation theatre, pull the pile and suture the vessel, close the vessel and remove the pile. Okay. In closed method, you close the skin, so there is no wound left. Earlier they used to do open method, now nobody does it. The same thing can be done using laser. That means instead of cutting the pile and suturing it, you use the laser to cut and suture, cut and coagulate, so you don't need a suture. The third method is to staple the piles. There is a stapler which is available, which staples the piles like a stapler like this.
The kind we use for paper?
Yes, it's exactly like what you use, but it's a circular stapler, and it just like a cookie, like a donut. You get a donut, it crushes the tissue above the pile. That means where the vessels are coming, it crushes that and you get a donut. So the piles which have descended down, it takes it up, and also it seals the vessel. Now the problem is, stapling and laser are very expensive, and most people can't afford, because the laser machine and the laser fiber is expensive, and the cost is as much as 50,000 to 1.5 lakh rupees, depending where you get. Whereas the classical surgery is also almost 1 day stay in the hospital, and it costs less than 30,000 rupees, depending where you get it, but anywhere between 20 to 30, maybe maximum 40,000. But laser is not like that, because laser, the machine is in crores, the fiber is expensive. So though there are certain advantages with laser, as in that the pain is supposed to be less, right? But we don't know, because I've never had a laser hemorrhoidectomy, nor have I had an open hemorrhoidectomy. So I don't know. It is very difficult to gauge whether the pain is how much less, in the sense whether the cost of laser in our country, as yet with a large population who have piles, can we do laser as a routine surgery?
Achha.
That is my question in my mind. If the cost comes down, of course you can do laser also. But at the moment, classical surgery and laser are equally available in most parts of the country.
So, talking about the causes, आपने बताया था कि the people who eat meat a lot, that is one of the reasons कि ऐसा हो सकता है.
No, it's not
Or
that.
is it like
Any kind of constipation. Generally, non-vegetarians suffer from constipation more than vegetarians, because the amount of fiber in the diet is less. because vegetables contain fiber. So if you eat a meal of vegetables twice a day, that should be enough to not cause constipation. The main thing is take care of constipation so that you don't get piles. Now one more important thing I wanted to tell you is, the people are so scared about pile surgery for what I don't know, that the average history of the patient coming to us with piles is 4 years, 5 years, 8 years, 10 years. And the hemoglobin, which is 15 grams, many times falls to 6 grams, 7 grams. They can't even do the daily work. At that stage they come to us, then we have to give them 3 bottles of blood and then operate.
But ऐसा क्यों होता है?
Because they are scared, they are told certain things कि piles किया तो संडास का कंट्रोल जाएगा, piles किया तो impotence हो जाएगा, erectile dysfunction हो जाएगा. It's all nonsense. It's all nonsense. Nothing happens. It's like you are doing something in Bombay and something will happen in Delhi. Cannot happen, right? Impotence is a completely different thing.
Right.
Erectile dysfunction is completely different. It's a different system. You are operating on the rectum and the anal canal. That is no reason. And in case of control, it doesn't go because you are operating below the sphincter. The controlling mechanism is above from where the piles are. The piles come down, they come down. So you are operating at a lower level. There is nothing to interfere with the controlling mechanism. So there is really no loss of control. So I would urge people that instead of suffering from piles for a long period of time and avoiding it or taking medicine, one thing you have to understand, piles can only be treated by surgery. The bleeding may come and go because whenever hard stools pass, it scratches the pile and it bleeds, and then again it heals. So they think that is okay. No, the pile remains as it is. The blood stops for a temporary period, again after some time it bleeds. So over a period of time they keep on losing blood, and because the artery is a part of the pile, they lose blood like one vati full of blood at a time. They don't realize how much blood they are losing, and that much blood cannot be replenished by the body.
Right.
So slowly they go into anemia.
Okay.
Yeah. Now,
So the best thing is that if they see any kind of these symptoms, it's
they
best
should go to a surgeon.
not a general physician.
No, because these are all surgical conditions. So whether it is a cancer of the rectum or colon, whether it is ulcerative colitis, or whether it is piles, ultimately if there is no response to medicines, they will need surgery.
Right.
In all these 3 conditions. So I classify surgical diseases is if surgery is the ultimate treatment. I am saying there are stages.
Right.
Like I said, in piles also you can put a band, you can do injection at an early stage. Same thing in ulcerative colitis, medicines are available to treat ulcerative colitis. But if those medicines don't work,
Right.
then ultimately you will end up with surgery. So nowadays we have our gastroenterology colleagues who do treat these conditions, because these people are physicians who have done specialty in gastrointestinal ailments, So what happens is they get references of these inflammatory bowel disease sometimes, and even early cancer is diagnosed by them, because when there is bleeding, even I would send for a colonoscopy to them. So when it comes to bleeding per rectum, the first thing that we do is put a proctoscope, which is a small metal tube, and see. Now it only goes up to about 15 centimeters. Beyond that we cannot see. Now if there is no piles and the person is bleeding, the next step immediately is to refer for a endoscope examination of the entire colon. That's when we refer to our gastroenterology colleagues who do a flexible colonoscopy, which means they put a flexible tube which goes right from the anus right up to the right colon. So any tumor over there can be photographed. More important, it can be biopsied. That is the important thing. Biopsy. You take a small part of that and find out what kind of growth it is, so that you know whether this is a cancer or not a cancer.
Right.
So coming to the next condition which causes blood, but as I told you earlier that this is occult blood. So the patient generally doesn't come directly to surgeons. They go for weakness, tiredness,
Right.
unexplained anemia. Unexplained anemia. There's no cause. Like for example, in ladies who have excess blood loss during menstrual periods, you can say, okay, anemia is there because of that. But in a male patient who doesn't have any obvious cause of loss of blood but has anemia,
Right.
you have to think of piles which he has not seen, or more importantly, a sinister thing like a cancer, because cancer will not, suppose the right colon cancer or colon here, it may not cause any symptoms in the abdomen before it becomes so big that it blocks the intestine. Then they'll start getting pain. But prior to that, there is a stage where it will only be anemia. And these are picked up by doing the occult blood, that is stool in the blood test, and colonoscopy. Of course, imaging, that is CT and other things come. But the predominant means you cannot do a surgery unless you prove it's a cancer.
Right.
So the only way to do it is through a colonoscope and a biopsy. Now the treatment of piles, other than surgery and laser surgery and injection and banding, I just want to also tell you what the patient can expect post-operatively.
Right.
Most of these surgeries are done under anesthesia, okay, spinal anesthesia. That means in the back you give anesthesia and so much of the body is become numb for about 3 hours.
The below part of the
Yes.
body.
Once the surgery is over and the anesthesia wears off, you are going to get lot of pain. Generally this pain is controlled with the help of infusion. That means putting some painkiller in the saline, and over a period of 1 day the pain goes down. After that, most people do not have pain except at the time of passing stools.
Okay.
This will go on for a period of maybe 4 to 7 days. But one thing I want to tell everyone, they should not sit Indian style. They should use a commode or a Western style or a stool over a Indian style bathroom, but should not squat down, because otherwise the stitches give way and the pain will be more. Generally we give some stool softener in the post-op period so that they do not get pain, and local anesthetic gel. Most people recover completely in 2 weeks time. So there is nothing to get scared of. I think people should go proactively, go to surgeons if they see blood in the stools and get it checked whether at early stage they can get by only with an injection or a banding.
Right, right.
Right. So I think that's there for the piles. So we'll see about the other conditions in the next episode.
Sure, sure. Thank you so much, doctor. So this episode has been very informative because piles is something which has become very common nowadays. And one thing to take away from this episode is that if you find blood in your stool, please go to a surgeon, because you could be at a very early stage and you can be treated very easily and properly, and you can
On
avoid
an outpatient basis.
Correct, absolutely, absolutely. Thank you so much, doctor.
Okay,
We look forward
thank you.
to further interesting and informative episodes.
If you have any questions regarding piles
Right.
or blood loss in the stools, you are free to connect with us by email or on the number given.
You can also put your questions on the comments below and we can get back to you on that as well. So friends, we hope this was very useful. If you like our video, please like, share and hit the bell icon for notifications, and stay tuned. Thank you.